Some questions are multifaceted, very critical in the nature of the question, and really can tell the algorithm a lot about how safe you are, okay? Because that's what this test is about. How safe are you as a nurse? If a patient is going bad and they're heading in a direction to be in a diabetic coma, or maybe they're heading towards seizures, or they're at a high risk for falls, are you the nurse who can recognize that and prevent the worst case scenario happening to your patients? Okay, and I'm going to coach you more on what that looks like, right? Because the NCLEX is a crisis test. It's trying to throw all of these potential crisis scenarios at you, and they want to know how you're going to catch them, how you're going to respond to them, or even if you recognize that there's a problem happening in the first place. Okay, so variable length computer adapted test with pass-fail rules that are super complicated. So we're not going to spend too much time on them, but I will tell you this. In order to pass the NCLEX-RN, though the test taker had to score about 51% of their questions correct at a minimum. Okay, so in other words, we started understanding that for you to pass, for the computer to shut off, you had to, as an RN, score 51% of your questions correctly. As soon as you get to the 51% mark, it shuts off. Okay, so that's not a lot. Okay, that is not so bad. For the PN, it's a little higher, 9 points higher at 60% of the questions that you are presented with. You have to score correctly, and then that computer will shut off. See, it's not like nursing school where you needed 75% minimums and 85% minimums, that kind of thing. You are fine with a 60% minimum. So when you're studying, doesn't that change a little bit how you focus your studies? You don't have to be perfect, but you do need to understand a lot of concepts, okay? That's where the 60% is going to come in. Do you know 60% of each of the 8 categories? If so, you get to pass the NCLEX, okay? So keep that in mind.